do you think fillers really migrate?
Well, you can. Everything that we do with injections is that we use strategically. There are some fillers that will migrate. There are some fillers that does not. And so if there are areas where we want the fillers to kind of diffuse, I wouldn't say the terminology migrate. It's not migration. It's actually diffusion. In the media, I mean, there's the recent sort of trend was pointing out like how a face looks if it's over volumized. But when I look at those patients, it really is not just how much did they inject, but which area was it concentrated on. If you just concentrate on one area and you inject a lot, it's gonna look like you injected a lot. But if you take the same, let's say, number of syringes and we distribute them kind of evenly throughout the face and strategically placed in certain areas, then it really doesn't look unnatural. It looks actually more natural than even your original, situation.
Hi everybody, welcome to our podcast channel. My name is Verana and I have Dr. Peter Lee joining us today talking about pyramid rejuvenation. So nowadays there are a lot of people getting filler injections done, and there are some of the misconceptions in regards to using hyaluronic acid injection fillers doing the full face volumization correction. So we do have some of the questions that for Dr. Lee to answer or having some explanation towards it. I still remember from last year, we did nice syringes of the hyaluronic acid fillers on my face as a pyramid rejuvenation procedure. And then a lot of patients see that video and saying oh my God, nice syringes is a lot. And they get terrified from it. But myself doesn't get any of the uncomfortable feeling towards nice syringes. I guess that's a different thing. I still see a lot of questions over there saying oh, will I get too much as a fillers? Will the filler migrate? Or is it easier to get water retention after you inject fillers? Things like that. So how do you address those kind of concerns? I mean, it maybe happens a lot in other patient experience, but in terms of your own experience, have that happened? And how do you address that concern?
Well, I mean, I think if your question is how do we actually decrease the risk of possibly, side effect, from fillers? I mean, every facet of what we do is important, and it really does start with number one, assessment. Number two, patient's expectation. Then it's really about, the technical aspect of injection. For me, I have an advantage over maybe other non-surgeons because I actually know the anatomy and I know the depth of certain structures. But for a lot of people, it really is about using certain techniques that we know that decreases the risk of certain problems. And we can, if you want to jump right into it, we can, okay? Which is, what's the number one, side effect of injection? Like any injection, it's possibility of bruising. And so, one of the things that we do to try to minimize bruising, number one, is really do a good, history. And if they are on, let's say, medications or supplements that may increase the risk of bruising, then we ask them to stop that, taking that medication about 2 weeks prior to the procedure.
Yes, those blood thinners, right?
Yeah. The other thing is that if it's a large surface area that we're injecting into, I really do think the local anesthetic with a little bit of adrenaline in there really helps with the bruising as well. Because what the adrenaline does is that it vasoconstricts, right? So the blood vessels become more constricted. So there's less possibility of actually kind of puncturing through a small vein, which may lead to bruising.
I guess that's the most advantage thing that I get my injection from a plastic surgeon.
One other thing that we do to minimize bruising is utilization of cannulas, right? So we don't really use sharp needle points to inject. We may use a needle to just numb it up, that area. But when we actually are placing the fillers, we're using blunt tip cannulas so that, again, there's less possibility of puncturing through a vein.
Great to know. I mean, I've never think about it in that way.
So, that bruising is number one. The second thing is pain. right? I mean, who wants pain, right? And sometimes we say, oh, it's inevitable that you're gonna be in pain, okay? Because we are actually, injecting needles. But there are ways to minimize the pain, okay? Which a lot of times leads to less than optimal patient experience, right? So number one thing that we do for pain is if they're not allergic to anything, then we apply topical anesthetic cream. The second thing that we do is use very small needle size. And so a lot of times we're using like 32 gauge or 30 gauge needles, especially for infiltration with anesthetic. And then, like I was saying before about bruising, the blunt tip cannula really has made the procedure much more tolerable because, when you stick a needle through, which is sharp at the end, it does actually cause more stimulation of nerve receptors, so you feel a little bit more pain. But when you're using blunt tip cannula, which kind of like just mechanically just pushes things away from the needle, from that cannula, then there really is less pain associated with that.
I actually didn't feel so much of the pain during my injection though. Even like I'm doing nice syringes, I'm not suffering from the pain. I guess that's the reason. Another concern that we are having is like, do you think fillers really migrate?
Well, you can. Everything that we do with injections is that we use strategically, right? There are some fillers that will migrate. There are some fillers that does not. And so if there are areas where we want the fillers to kind of diffuse, I wouldn't say the terminology migrate. It's not migration. It's actually diffusion. Let's say we're injecting a hollow temple region here. Okay? Then you kind of want to use a filler that kind of diffuses so that it blends in with its surrounding tissue. Whereas if you're injecting into a line, like nasolabial fold, you really don't want diffusion. It really is about what product to use, okay, how much of it, and what location are we injecting it into. In the past, we used to think about using the filler to kind of fill in lines, right? So as we get a little bit older, the thing that sometimes sticks out is, we start developing this nasojugal groove, right? Sometimes we get this line at the corner of the mouth called Marinette line. So for initially when we started doing the injection, that's what we were focusing on. The reason why we coined the term pyramid rejuvenation is in a lot of patients, they actually need a foundation first. And sometimes if you just fill in lines, it may kind of like make that line better, but it doesn't kind of like give you a full sort of fresher look. Sometimes it looks actually abnormal. So the first beginning of pyramid rejuvenation really is taking a look at facial contour first. And that means looking at the boundaries of the periphery. These days, we describe an aesthetically pleasing facial contour as an inverted egg shape, where you want kind of smoothness with the largest width, at the level of the cheekbone, right, and kind of a more of a gradual curvaceous point down to the chin, right, and so. Typically, we start with setting that periphery, seeing how that patient is, the contour is, relative to what we think is the aesthetically pleasing facial contour. So typically, for a lot of people, it is about loss of volume in the temple. Some people, because they lose kind of just the overall soft tissue volume in the forehead, so sometimes the forehead itself is a little bit flat. And then kind of like going down to the side, it is about the submalar region, which is the area just underneath the zygomatic bone. And then have it so that it connects well with the chin. So it kind of depends upon patients, but we start with that. A lot of times though, if they're a little bit saggy here, which we call jowls, then we can sometimes make that connection of a little bit of jowls with the chin. And usually that transition point, there's a little bit of a divot, and we can fill that area in as well.
So it's more of a full face correction based on individual's facial volumization contouring.
Exactly, exactly. Because like sometimes like we see the line and then we get focused on it. But a lot of times, I mean, you actually do need to start from the basic, which is facial contour. Where is it most hollow, and where do we think that there is a deflation effect?
I guess that's one part of the full face assessment before injections, right? How do you have a protocol of like?
So we go from outside to the inside. And so as we make our kind of way towards the inside, then we are looking at places like the cheek itself, the smile line, the marionette line, okay, which is at the corner of the mouth. And these are the areas that we sometimes address. And in some patients, it is about filling in the eyebrow region as well. Okay, so that there is a little bit more kind of a distinction. And then that's the second layer. And then the third layer really is the central region. Okay, so we are talking about the nose, if need be, the lips, and then chin. Okay? So these are the kind of the way that we kind of evaluate a patient. And from a technical standpoint, we go from that outside to inside approach. And that usually leads to pretty natural result. And it's not overdoing it either, okay? Because if you just do one area, even if it's small, sometimes it doesn't really match the rest of the face. But if you go from outside in, even if it seems like we're using a lot of fillers, it definitely doesn't look like we're using a lot of fillers because they're all balanced out. And there is no one distinctive area that stands out because everything else is blended in.
Yes, and you're actually injecting in different areas, so you know the syringes may add it up more at the end of the injection, but it's actually like separating into different areas, so it's not too much.
It transitions smoothly.
Of course.
Between the different areas.
I still remember like 1 year ago when you before you inject, you draw on my face. And then right now, after you make the explanation, I know what you're doing at that time. There are so many of the products right now in the market that has hyaluronic acid fillers. How do you recommend them in terms of like what exactly products you should use in what kind of areas?
Yeah, there's actually a reason why there are a variety of fillers. And it's really because some fillers are better for certain locations than others. Okay? And so the way that we kind of break down the fillers is in terms of concentration, cross-linkage, and the molecular weight. And they all lead to a certain clinical outcomes. So let's say that we're injecting it into like a hollow region by the cheek. Okay? Then you kind of want to use something that is a little bit more firm that can kind of lift the tissue up as it kind of like is injected, as well as like a little bit of absorption of water to kind of make everything more blended in. So there are fillers like that we strategically use in certain places. Now there are certain places where you don't want it to absorb much water at all because what you're creating is a distinctive feature. And so those are usually confined to places like the nose. Let's say we're kind of like contouring the nose with the filler, or like the chin, or even places like the malar prominence. Most fillers that we're using that's FDA approved are temporary fillers. There are some permanent fillers, such as liquid silicone and so forth, but it's certainly not FDA approved. And in some patients, it can lead to pretty bad and unnatural result. Okay? And because these are permanent fillers, the only way to remove them then is surgical. Okay? So if they look unnatural or if there's a migration, then you can't just wait it out, nor can you inject anything to melt it. You have to surgically remove it. Yes. So 99.5% of what we use now really are temporary fillers. But even among temporary fillers, there are what we kind of like separate that into two categories. The first is the product itself volumizes. The other category is a product that disappears after a few months, but the mechanism of action is stimulation of collagen to kind of like, make that area fill in. So a good example of these collagen stimulating products are things like Sculptra, like Bellafill. Okay? So these are products that stimulates your own tissue to grow in. So it's actually pretty good for large surface areas. So like the temple region, like the submalar region, I mean, these are actually perfect for something like Sculptra. And something like Sculptra, also that product, by stimulating collagen growth, that also kind of like helps with a little bit of lifting as well. And so we strategically use Sculptra for a combination of both, the volume replacement as well as lifting. Now, the other category, which are temporary fillers where the product itself volumizes, there are different types of product that we sometimes use. Like the most common, obviously, is hyaluronic acid fillers. The other types are things like Radius, which is calcium hydroxyapatite, or like bovine collagen. Okay? The reason why we use hyaluronic acid fillers as a temporary filler of choice really is because, number one, it's inert, which means you don't really get any type of inflammatory response. The second is, if you don't like that product, you don't have to wait, that 9 months to a year till it goes away. There are specific medications that we can inject. It's an enzyme that dissolves the filler, the hyaluronic acid fillers.
I'm pretty sure this is one of the best things that a lot of patients like. It's like you always can regret of it.
And the other thing is, like sometimes like patients, they will get like kind of focused on, how long does it last? I wish it lasts longer, right? But actually using temporary fillers is actually advantageous because, as we get older, things change, right? And so the places where you thought that you needed volume changes as well. So if the product itself stays the way it is, but the rest of your soft tissue changes, and sometimes the area that you thought looked pretty good, now it looks kind of unnatural because you have the static product in a place where you don't really need volume anymore.
Exactly.
You need it in other places.
Yes.
Yeah.
You're changing like all the time.
Yeah, so that's why like still, for majority of patients, we are using hyaluronic acid fillers. But for large surface areas, like the temple and the submalar region, our product of choice really is Sculptra now.
That leads to another question that a lot of patients will have. Like, how do you know if I need a filler to fill in this hollowness to make me look younger, or I'm actually needing a lifting procedure? So how do you make decision on that?
Yeah, and again, this is why you have to spend time with the patient and understand, what the patient's want is, because ultimately at the end, it's that patient's want. It's not like what I think. Aging process is complicated, and certainly sagginess and volume loss. These are two major elements, right, that happens to our face as we get older.
And a lot of times they happen together.
Yes, always, right? There's always some degree of sagginess as well as hollowness in most people. And so it really kind of depends on that individual, right? I mean, you're asking me like, how do I make that decision? One of my kind of like pet peeve is try to have that patient actually show you a picture of how they used to be when they were in the 20s and 30s. And the reason why I do that is it's not like as if we're gonna like make that patient look like she was in her 20s and 30s, but really to assess volume, right? Like how much volume did they really have? It's and so a lot of times if the volume has decreased significantly, then certainly volume replacement is important. But if, let's say, the volume is about the same, but it's mostly like sagginess, especially in the lower part of the face, then it is about lifting. Okay? The fillers, its primary purpose really is, number one, filling, like filling in area that lost volume. A lot of times people sag more because of the deflation effect, where if that area becomes hollow, then there isn't really much of a support, and so the soft tissue can sag more. So like I think overall, I think in terms of fillers, right, and like what, whether we need volume versus like addressing the sagginess, a lot of times you get actually both with fillers.
Doctor, in terms of like the difference between fat transfer to face or any sort of filler choices on the face, how do you think like it is differentiate with each other?
So I would sort of say a fair comparison would be something like fat transfer versus Sculptra. The way to kind of think about fat transfer is large surface area. Okay? So similar areas that we just talked about. Okay? Yeah. And the comparison is with a fat transfer, it is surgical. Okay? Because we do have to kind of like give you some sedation. Okay? And it is about harvesting fat from one part of the body, usually like your stomach, your waistline, your thighs, purifying it, and then injecting. So that's fat transfer. Whereas Sculptra, it comes readily available in a vial, okay, that you can just inject. The difference in terms of result is both look very nice and for the appropriate patients. But with fat transfer, we do think that it's semi-permanent, meaning that the volume that you actually place in a certain area for fat transfer, once that fat cells live and there is blood flow that goes into these fat cells, then they're permanent. Yes. It's just that not all of the volume that you put in with the fat ultimately survives. Okay, so these are living cells, right? So if we detach it from your body and you put it into a new location, it's actually going to get absorbed unless blood circulation flows into it. Once the blood flow circulation flows into it, then and the cell lives, then that's permanent. And what we usually say is about 50% of what we inject ultimately survives. And so sometimes, like with a fat transfer, we sometimes do have to do a touch-up, usually like 6 months later, to see if they need a little bit more, then we do a little bit more at that time.
I'm also heard something about like a combination of injecting neuromodulators together with fillers as a lifting results combination with like a filling up result, rejuvenation. Do you think that really works better with having them all together?
Yeah, I mean certainly I think you're obviously talking to a plastic surgeon, right? So when somebody comes into the plastic surgery office, they expect actually results, right?
Yes.
I mean, not one of those results where, you look subtly like a little bit better, but really better, okay? And so when we're talking about non-surgical treatments to address certain needs, usually it's not one particular type of procedure. You really do have to kind of mix it together to give a full effect. Okay? So yes, you're right. I mean, people with volume loss, let's say due to age, they certainly can use, neuromodulators to sort of help with the lines, as well as kind of like lifting certain areas. Okay? So we sometimes use these neuromodulators. We inject it into the skin to kind of give it a little bit of a lift. Yes. Okay? And so, as we talked about earlier, aging is about volume loss as well as sagginess. And if you address both, you'll only look actually better. And that's why kind of it's important to sort of kind of take a look at not just I'm coming in for one procedure, but you're coming in for what concern, right? And how much of an improvement are you looking for? Because a lot of times we do have to do combination.
Yes. Yeah. It needs a full assessment of like the expectations, like what is your concerns, things like that. I totally got that because I've done a couple of procedures like treatment before, and I really do feel like if you only address one thing, then definitely you're going to coming back in the future for another thing, and then it's like never ends.
And that's why pyramid rejuvenation is something that we really like, because if you treat certain areas, even just a little bit, right, as you target the area that's of concern the most, but if you do a little bit in other areas, then the whole face matches better.
Exactly.
Right?
Exactly.
Sometimes, like if you just do one area and just concentrate on that, that area may look really good, but it's out of balance to the rest of the face.
Yes. Dr. Lee, how frequent do you think patient can do like perimeter rejuvenation? Because certainly, like fillers goes away. And then sometimes, when patients see themselves in a good condition, and then when the filler goes away a little bit, they just can't tolerate it. They want to come back and do it right away. But do you recommend doing it too frequent, or what is the frequency that you recommend?
Everybody's different, right? I mean, everybody, it's amazing how some patients, a filler, a hyaluronic acid filler, will last, well over a year. And then there are some patients that even after 6 months, sometimes, like you kind of lose that effect. Yeah. And we really think that it depends upon the patient's metabolism. But all in all, I think what the appropriate thing to do is always see the patient back after about 6 months. And at that time, take a look at the entire face to see what area in which there is still fillers and what areas actually in which the filler actually has absorbed. And so we don't really generalize anybody. I mean, it really is customized. And like you said, a lot of times the patient knows when like they are losing that, the effect of the fillers.
Because a lot of times, like they're not losing so much, but it's just a matter of aging process, Yeah. And then they're like, oh, I can't tolerate that. I want to do it again. Right. Like me too. The same thing. Like right now, I really want to do it. Like I can't tolerate it, but like I was looking like this before.
Like in the media, I mean, there's the recent sort of trend was pointing out like how a face looks if it's over volumized, right? But when I look at those patients, it really is not just how much did they inject, but which area was it concentrated on? Because like we're talking about, if you just concentrate on one area and you inject a lot, it's gonna look like you injected a lot.
Yes.
But if you take the same, let's say, number of syringes, and we distribute them kind of evenly throughout the face and strategically placed in certain areas, then it really doesn't look unnatural. It looks actually more natural than even your original, situation.